Mayada. It gives me great pleasure to introduce a friend, a classmate, Dr. Mayada AbuAffan. Dr. Mayada AbuAffan is a consultant in public health. She works in the UK, in Dudley. And Mayada is actually dual trained. Mayada has been trained as an obstetric gynecology doctor, and worked as an obstetrician for many years. And then before sort of going into public health with a conviction that she needed to address the wider population, and that is the main theme, and being in a position a position where you were able to achieve a sort of a voice to empower people and to have a bigger impact on health generally. Mayada is a leader, an effective leader, and she has had a lot of training and trains a lot of people, a lot of experience in effective systems and effective leadership. Again, founding member of many forums, Sudan Public Health Consultancy Group in the UK, Public Health Africa as well. And Mayada, you often describe yourself as a transformational leader. Interesting, this morning we heard from Hanan about inclusive leaders. Be really nice to see how these sort of go with each other. So really interested in hearing your talk today about leadership in the era of COVID-19. Over to you, Mayada.
Okay, thank you. Thanks, Sarah. And welcome everyone, and happy Women's Day. And thank you, Watts, for giving us this opportunity. Before I talk about leadership lessons learned from COVID, I'd like to have a message, or to give a message to women in the Women's Day. Please don't think as a victim or behave as a victim. Strength starts from within. You have to believe in yourself. You have to believe in you are strong enough. You can change the world, even the small world, even changing yourself. And people treat us the way we think about ourselves, the way we treat ourselves. We project, if we think as victims or weak, we project that weakness and that victim picture or approach, and allow people to treat us as the way they are. Women, as Sarah said, I used to be an obstetrician. Do you know, baby girls are much stronger in withstanding the stress of delivery. They are much stronger at a cellular level. And I think this is a way God made it to allow the humanity to continue. Okay, so if a baby is stressed in utero, if it's a girl, they are more likely to withstand the hypoxia or the lack of oxygen. Women live longer than men. So although men say they are stronger, but physiologically, we are stronger. We're not like the muscle strength, but in terms of withstanding stress and in terms of being able to perform and the resilience, we are stronger. So celebrate that strength, women. Thank you. Okay, so I'll go back to the lessons learned, leadership lessons learned from COVID. And I think, Sarah, you talked earlier in the morning about inclusive leadership. Let me start a slideshow. Okay. So COVID, as I said, it's a real pandemic. Okay, and we faced as leaders or people managing to working to manage COVID, huge challenges from the start. Okay, the how spreadable the infection is. No cure or readily available vaccine. I'm talking like 12 months ago. And the sudden pressure on healthcare systems, the psychological and economic impact of the lockdown, and recently the rollout of a mass vaccination program. For the first time in recent history, in humanity ever, we had to roll out such a huge vaccination program. So the challenges we are facing, okay, we needed to influence at a scale. I mean, we as corporations, we needed to work across countries, systems, and organizations. We needed to work across uncertainties and things might, you're doing this today, you have to change it tomorrow. We need to manage demand and on healthcare systems, resources scarcity, and we needed to build a stronger leadership at all levels. In terms of the vaccination, we needed to think differently and have a strong focus on inequalities and of COVID morbidities. COVID, from the start, it showed clear inequalities. Unfortunately, inequalities towards ethnic minorities, more of them, they are capture the infection, and more of them died from the infection. And now in the vaccine, less of them are taking the vaccine. Okay, so this is, and it's going to leave inequalities. We will have to live with it forever. So very early on in the pandemic, organizations and systems realized that they cannot manage COVID on their own. They have to think widely, and they have to think widely not just within their own place or their own uh, geographical area, but they have to think nationally and they have to think globally. One also of the things which is I will focus on a bit today is the partnership with communities, which is the inclusivity. We very early on realize if we don't develop very strong partnerships with communities, we are very unlikely to be able to manage, not just manage the infection and the disease, but also convincing the population to follow the control guidance, and also to convince the population to take the vaccine. So the first, I think, style is the system leadership. And the system leadership, it's a mindset and a professional style. It's the inclusivity. It is the focus on relationships. System leaders are very, very good in building relationships. And one of the things we had to do, although we as in public health, we always work with communities, but in COVID, we had to do really, really very focused and to work very hard in terms of building relationship with communities. How we did that? We had first to understand in depth those communities and what are those barriers within those communities. Okay. And then we had to utilize, and for the first time, the assets within our teams. And people who are working in the UK, you would understand that you never project yourself as in your workplace as an Arabic speaking person. But now, no, we are, because now we are reaching to the Arabic speaking communities within those communities. Okay. We had to go to the front as a BAME, and then we had to say, like our Caucasian colleagues, they think you can't stereotype BAME and you say no at an and just do a BAME related session. But we as BAME, okay, and we had to take that responsibility and say no, you shouldn't sugarcoat the message. BAME are at increased risk, you have to say you are at increased risk. Okay, you are at increased risk because you are poor. Yes, these are facts. You cannot sugarcoat the facts. So we had to, I think, to be stronger in terms of acknowledging the cultural diversities and look at the positives rather than see it like, no, you are stereotyping that culture. No, you are working to maximize the health of that culture. We had to, in terms of the vaccine, we had to utilize, as I said, assets within our teams to reach out to communities, but also to utilize assets on those in those communities more effectively, like faith leaders, like community leaders. We had to appoint COVID champions to go into those communities and discuss, and even door to door. And those champions, they have to be from a ethnicities that resemble that community. So we had to really go for the positive discrimination, and do it in a bold and in a strong way. And in terms of the ways, we needed to understand the hesitancy of those communities in accepting the vaccine. Is it access? They can't get to the clinics. Is it language barrier? Is it concerns about safety of the vaccine? Is it like personal experiences in the past? Is it cultural values? And we had to go to that granular level of cultural diversities and understanding. And this is all in a thinking as a system leader, okay, enabled us to do this. And still we are working on this in terms of understanding the community. As I said, in terms of a system leader, you have to think, I lose as a person, but we win as a system. And this is a mantra we used to use now when we are reaching out to communities. We have to think of the whole community, and we have to think of their welfare and their health. The second leadership style is the agile leadership. I am sure you all face this in your work in COVID. That the situation is changing very, very, very quickly. You have guidance today. You woke up in the morning, the evidence is changed, and you have to take a U-turn. Okay, so leadership in that situation, we needed to plan, set flexible direction, and start the flexibility within ourselves. But at the same time, we have to execute with calculated speed. And you can see the speed by which the vaccination program is being implemented or rolled out in the UK. We needed to think about resources, and we needed to learn how to offset the fake experts. Can you see how, especially with the vaccination program, and fake experts, one fake expert is different from the other fake expert, unfortunately. Okay, so one style in terms of addressing that person is totally different from the other one. So one of the things really we had to work and we had to utilize is the skills of agile leadership. And then we needed to think outside the box. We needed to think about transformative leadership. We needed, as I said, to be flexible. We needed to maintain trust with communities. So one of the things we found in terms of reaching out and building relations with communities, communities trust members of their own community, expert members of their own communities, more than expert members from other communities or different communities. So we had to utilize this, as I said, more strategic staff and from ethnic minorities. Now they are on the front line and they are leading on this building relationship with communities. And also, and we needed to really encourage staff to be able to innovate and to run the extra mile. Not just staff, but encourage as well the community members we are working with. The third style of leadership is we needed to focus on productivity and lean processes. So productivity is around spending the least amount for the maximum gain. And they are the things we needed to focus on in terms of these are the productivity framework, the prioritization, clarity on roles and responsibilities, clarities on expectations. We have to have clear and simple communications. These clear and simple communications, to be productive, we had to co-produce it with communities and with clients, because if you think, oh, this is the way I'm going to sell the vaccine because this is, I think, what they wanted to know or what they needing to know is different. Okay, so this is why we started to utilize the co-production approach more, utilize it more, and at all level, operational, intermediate, and strategic level. In terms of productivity, we had to think of solutions, because in the middle of managing COVID, for you to start just thinking on problems and focusing on problems, it will really demoralize us as teams working on the field. And we had to delegate more, utilize tools which will help us in doing our work, like the project management, and we are working on resources and identifying, as I said earlier, community drivers. So I think the learning from COVID for us as ethnic minorities and for us as women, okay, and through going through this at different leadership levels, is how can we reduce the inequalities of COVID, the health, the social, and the economic inequalities? What would be our parts as individuals or organizations or systems or non-governmental organizations? We've learned a lot from COVID. Okay, we are working together more as a globe and as humanity. Now we are telling the population is, please take the vaccine to protect yourself, your loved one, and to protect humanity, because this is the only way we can address or get over this pandemic. So there is a sense of togetherness. So how can we build on this sense of togetherness and support each other and reduce the impact of COVID on us as minority ethnic groups, on us as women, and on us as human beings? Well, thank you very much.
Thank you very much, Mayada. That was a really comprehensive talk, and it was quite helpful, because I think many people don't know the work that goes behind the scenes in the COVID vaccination program and updating communities. I know firsthand the work you've been doing generally with Public Health England, and sort of the work you've been doing across the board with the Black ethnic minority groups. I just want to touch on something you did mention, sort of positive discrimination and generally bringing focus to the ethnic minorities. But again, there's many intersections in that itself, isn't there? So like you said, it's not one Black ethnicity, it's different ones. And I would argue that's still quite a large cohort of the population who are still unaware of much at all about. I'm thinking about women, mostly women, something that Noor Al talked about earlier, very much bound within the cultural aspect, where they're still looking to the men to advise on what they should be taking or not, and very much dependent on what the men are saying. So again, that I can see that as still an ongoing challenge. I'm just wondering about how diverse and how much reach are you able to manage in regards to sort of passing the information?
Strange enough, while you are talking, Sarah, I just realized I said we're working closely with community leaders. They are all men. All community leaders of Black and ethnic minors I came across are men. Okay. And when you ask specifically about women in that culture, you get a very defensive answer, because I did ask one of the communities, how could we reach women in those communities? No, 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 they do have their groups and blah, and we can reach those women. The I think the journey is long, and it is hard. And then you need to, as I said, we need to be a bit bold in terms of addressing cultures within communities. Maybe because we are Black and ethnic minorities ourselves, we can afford to be that bold, because no one will like say you are racist or can uh, uh, so I think we need to promote leadership within those communities, and that would be the our role as women leadership in those communities. You will find the odd ones, the ones who wanted to get educated or got a career, for example a nurse or a doctor or someone, but not the majority of the communities. So I think that there is still a challenge, to and a mountain to climb.
Thank you. And a personal question to you. The sort of the distinction between leadership and management. Mostly my experience has been with women leaders. They're more into the management aspect of things. And I'm just wondering how you find it, generally being a leader, sort of driving the change and having the vision, rather than sort of implementing the changes by other leaders.
Thank you, Sarah. Very, very important question. So, every leader has to be a manager, okay? But not every manager can be a leader. So a leader, as you said, Sarah, is the one who sets the vision, the direction, and who inspire. And I think this is the most important. When things go wrong, people go to the leader for help and support, to inspire and to collect the pieces. Okay. And I always like a mantra which says, a leader, when things go wrong, they look in the mirror, and then when they go when they go well, they look outside the window. So they give the credit to their staff and their teams, but they take the responsibility of the the mistakes. Okay, so a manager, they are bound by KPIs, they're bound, and a manager, when you make a mistake, they'll tell you you've made a mistake, you should have done this way and done this way. So unfortunately, the boundaries between the two, not lots of people understand that, and most of us are managers most of the time. Okay, but especially in COVID, because in COVID we are dictated by, the vision is dictated by nationally, but you will have your small ways to maneuver to develop a vision and these things. But we as a women, in terms of women empowerment, and in terms of inspiring women, and I think we need to be true leaders in here. What Noor Al Ain said in terms of women shaming other women and these things, if we tackle it as managers, we would say, no, you shouldn't have done that. You should have accept women as they are. But if we address it as leaders, we need to think, why this woman who is shaming the other woman, how can I inspire her to accept herself first and then accept others? Because if you are in peace with yourself, if you have self-confidence and you're accepting yourself fully, and I like the mantra Nur Al Ain said, you don't need to put some other people down to feel good about yourself. So that's the difference between a leader and a manager in that example.
Well said, Mayada.
For me, education is the key for my future.